Hi, in this video, I'm going to take you through a replicated case note that has appeared in one of the most recent OET exams, which was held on 26th October 2024. Now you can see the case note on the screen. So when you read the first line of the case note, you understand that you are a nurse in the post-surgical ward where the patient is admitted and the patient is to be discharged to a rehabilitative center. Now from here, we directly move on to the writing task to understand who the reader is. From the writing task, we understand that we are supposed to write letter to the head nurse of that rehabilitation center. And for what purpose? It has been mentioned here in the writing task as outline his condition, medication and further concerns. So we understand that we are supposed to write letter to the head nurse of a rehabilitation center outlining the current condition of the patient, his medications and requesting for further management. Now, the detailing of this requirement, we can see it from the plan. If you go through the plan, you can understand that the points that mainly appear under plan are continuation of medications such as paracetamol and ibuprofen, then wound management, then physiotherapy continuation, assistance with ADL, and so on. So by now, we have clarity on who the reader is and what are the responsibilities of the reader. Now, we get back to the top of the case note to understand the story of our patient. And keeping this purpose or the requirement in mind, that is who our reader is and what is the reason for writing the letter, based on this, let us go through the case note to identify which are relevant, which are semi-relevant and which are irrelevant. Now let's go through the note forms to identify them as relevant, semi-relevant or irrelevant, keeping the purpose of the letter in mind. First data is today's date, of course that is relevant. Then patient's name and date of birth, they are relevant. Occupation, retired government office, it's not a relevant detail. Then lives with wife, wife has breast cancer and is on chemotherapy. Now, we can consider it as semi-relevant for the time being because the patient from the hospital, he's not getting discharged back home. He's going to the rehabilitation center. So maybe this detail might turn out to be useful to the reader. So let's put it on hold. Then hobbies, reading, it's irrelevant. The alcoholic and smoking, his habits, they can be considered as semi-relevant details, not very relevant to the reader, but since they are habits, they can be considered as semi-relevant details. Now, from the social background, now we move on to the medical background. From the medical background, we can see that he has asthma and diabetes and he's on regular medications for both of these conditions. And you're writing to a head nurse, so both of these points are relevant. Then when you observe closely the points from Jan 2023 to Jan 2024, what you can see are a list of ideas which actually led to this herniated disc removal. So initially the patient came with pain and the CT scan revealed disc bulging, physiotherapy was advised, pain management techniques were advised. Then he had worsening of pain. So these are all points which tell you how did they end up with this decision of surgery. So what we understand is that we don't have to get into the details of those because now we are writing to the head nurse for rehabilitative care. Considering this idea in mind, these points, that is the points prior to the surgery, we need to present only it in a concise way. So we don't have to get into the details of all these. All these can be summarized maybe in just one sentence. Okay. Now, then next we'll consider this herniated disc removal. Of course, that is relevant. Then comes the post-surgery part. So from post-surgery, we can understand what they have given us: administered IV antibiotics, analgesics, antithrombotic, then drain present, that can be considered as relevant, shifted to ward, irrelevant, drain removed. So drain, earlier it was mentioned drain is present, now it is mentioned drain is removed. So that drain aspect can be now considered as irrelevant. It's no longer needed to the reader. Then swelling and bruising reduced, wound healing, vital stable. So all those are indication of good progress. They can be considered as relevant details. Then physiotherapy, light exercise and 5-minute walk, of course, they are relevant. Then wife concerned, unable to give care after discharge, require rehabilitation care. So that is actually prompting us to the rehabilitative care. So that point is relevant. Earlier, we were confused whether to consider this detail regarding wife. That is, wife has breast cancer and is on chemotherapy. Should we consider it or not? Now we understand the significance of it. And so that should be considered as a relevant detail. And now moving on to the last part of the case note, that is plan. We cannot compromise on any of these aspects because all of these are part of continued management which the head nurse of the rehabilitation center has to take care of. So we need to include all the points from the plan in the letter. Now we have done the data selection. We need to decide on the organization, the structure of our letter also. We have decided which all data are relevant, irrelevant or semi-relevant, keeping an idea what the purpose of a letter is. Keeping the same idea in mind, let us decide the organization. So here, since we are writing to the head nurse of the rehabilitation center for rehabilitative care, continued care, of course, we can start with the current happenings, the recent happenings, that is the herniated disc removal and the associated care given from the hospital. And then we can talk about the history or the background details. Okay? Then, the main thing that we need to decide before actually literally starting off with the transforming of the case note into sentences is that we need to decide the purpose of a letter. So when we write the purpose of the letter, there are certain aspects that we need to have clarity on. That is who the patient is, of course, we know it, and what is the requirement that we understand from the writing task, that it is for rehabilitative care, and what is the reason why the patient requires this rehabilitative care. That is, the reason is that the patient is just now recovering from a herniated disc removal. So we've got these aspects, and we also need to identify the type of the letter. Here, in this case note or writing task, it's nowhere explicitly mentioned that this is a transfer letter, whether this is a transfer letter or a referral letter. But we need to understand that this is a transfer letter because the patient is being discharged from our hospital, but he's not being discharged back to his house. Instead, due to his wife's inability to take care of him, now he's being shifted to a rehabilitation center to continue the management. So basically, this is a transfer letter. That is, the patient is being now transferred from our hospital to a rehabilitation center to continue the management. So the type of the letter is a transfer letter. Now, incorporating these ideas, we can present the letter in your own, you can present the letter in your own way. But there are certain things that we should be careful about. That is, the content and the structure of the letter should be appropriate to the intended reader. So keeping these ideas in mind, I present before you two sample letters. Now, when you compare these two letters with these two samples, the purpose paragraph is more or less the same in both the samples. But when it comes to conciseness and clarity and the structure, that is the organization, you can notice minor differences between the two. That is, when in one sample, what you can see is that the pre-operative or the pre-surgery details have been presented in a very concise way in one sentence. But in the other sample, a detailing of the pre-surgery aspects have been given. But even then, they have managed to restrict the letter in 190, 194 words. So that is fine. Then another aspect when it comes to organization is that in the first sample, this social background has not been highlighted as a separate paragraph. It has been linked in an appropriate way or in a logical way wherever possible. But in this sample, the social background has been presented as a separate paragraph. That is again fine. So if it is appropriate or if it is understandable to the reader, and if the content is fine, and if you have achieved the conciseness and the structure or the organization is smooth, all the samples are fine. So if you have your own opinions or queries regarding the samples, please do post it in the comment section. And if you have your own samples, please do come up with those ideas. Until then, stay tuned. Thank you.
MedCity International Academy. Trusted hands forever.